you feel with the CeraRoot, with the surgery, a few days after the surgery? How was the experience for you?
I wasn't nervous at all for the surgery, and it went really well, as far as I was concerned.
Was it painful? Did you feel comfortable? Were there a few days where
Did you put something in there for me?
you felt like the healing wasn't taking place or anything?
No, I had a little bit of swelling or discomfort, maybe in the first 6-7 hours. And then the next day I was fine, and it felt like it healed within a couple of days, but it probably took longer, it just didn't hurt.
Yeah. So after you had the implant piece, you had to wait a few months for the implant to heal, and then after that, when you were ready for the crown, you came for a full mouth a mold so we could make the crown. How was that experience for you?
It was fine. It felt very similar to when I've had a crown done before for a tooth. It didn't feel any different than any other crown.
Great. And now that we've actually cemented it today, how does the crown feel? How does the material feel? Was there any discomfort?
No discomfort, and it feels like my gum is, better than my gum was before. Actually, it healed up really quickly and really well. And the surface of the crown feels great, and it feels weird having a tooth in my mouth.
Oh yeah, so long from not having it, yeah.
From not having a tooth in my mouth for a while, but the bite feels really good and feels strong.
Great. And why did you choose to have a CeraRoot implant rather than a regular titanium implant that's at the market?
Well, it's interesting because I cracked my tooth, and we didn't know if it went all the way up or not, but because I was so opposed to having metal in my mouth, because I had all the metal removed, and I felt very informed as a patient and a consumer, I did not want to have metal. So I thought at the time the only thing available was titanium. So I chose to actually have a root canal and do a crown on the cracked tooth to try to hold on to it. But then when I realized I needed to have the implant, I researched and found that there was a non-metal type of an implant with CeraRoot. And so I was very clear that's what I wanted to do. And it was the best option available, and I was lucky to find it and to find a doctor that was experienced and put it in.
Oh, great. And were you nervous that there weren't so many doctors who were actually using this implant?
I wasn't really nervous about using CeraRoot, even though it hasn't been in the United States for a long period of time like titanium has, because I also know that they use mercury amalgam for years, and my dentist would say it's perfectly fine, but I did research that showed in Europe they knew it was not good to be using mercury amalgam. So when I was making the decision about an implant, I felt I did my research. I knew that this CeraRoot had been used for more than 10 years in Europe, and the U.S. just needed to embrace that it was an alternative titanium.
Great.
Also, I know from looking at on the internet and also talking to other implant surgeons that there's a certain amount of risk involved when you use titanium because it comes in two parts. There's the, I guess, the implant and then the abutment. So in that area where it's screwed, you'll end up getting bacteria, and it's like a pathway for infection. So I was very happy that with CeraRoot it's all one piece, and there's no area for you to get an infection or to have issues without being compromised.
Right, because the implant and the abutment are all one piece, and we just have to cement the crown. Yeah.